Visible fat means the food which is visible to us as a fat, like oil, ghee, butter. These are the visible fats. And invisible fat means the fat which is contained in other foods like cereals, pulses also contain some amount of fat. Omega 3 and omega 6 you should know. We should know the various other components of the fat, that is HDL and LDL, high density lipoprotein and low density lipoprotein, saturated and unsaturated fat, essential fatty acids. This all you must have learned in biochemistry, so we'll not go into detail. Then nutrition requires minerals, vitamins, macronutrients and micronutrients. There is another classification nowadays coming, type 1 food and type 2 food. Then fibers, and of course water is an important component of any food. The first feed should be given as early as possible. If the baby is low birth weight, still further earlier. The requirements of fluid is 150 to 200 ml per kg per day if we are giving orally or IG. And if we are giving IV, it is 125 to 150 ml per kg per day. This is more so in the first month of life. Calories 110 to 120 calories per kg per day. The other figures, you know, according to various formulas are there. You can go to those formulas for further calculation. Protein, usually 1 to 2 grams per kg per day. You must be knowing that in adult it is 1 gram, older children it is 1 gram. But first 1 to 2 years of life, it is more, up to 2 to 2.5 grams per kg per day. This is because the first 2 or 3 years are the growing period of the life. The nutrition can be given orally, intragastric, nasojejunal. Then it can be breast milk, express breast milk, cow's milk, buffalo's milk, or formula feeding. And of course, you have intravenous fluids and total parenteral nutrition. We start with the breastfeeding, and you must know that breast milk is tailor-made as per the need of the offspring. So breast milk of all the mammals will be different. The protein content will be different as per the growth rate of the offspring. So one milk cannot be compared with the another milk. So the breast milk is not only species specific, it is also gestation specific. So preterm milk will be different than the full-term mother's milk. What are the feeding recommendations? The latest recommendation is that first 1000 days of life, which includes the pregnancy 270 days, first year 365 days, and 365 days of second year. So these 1000 days are very important, and out of this, the first hour is known as golden hour. That means the breastfeeding must be started in the first hour of the life. Exclusive breastfeeding for 6 months. After 6 months, complementary feeding plus continued breastfeeding, and the breastfeeding should be continued minimum for 2 years. During breastfeeding or during any feeding, mother should converse and communicate with the child. This is known as interactive feeding, and this is important because it stimulates mental and emotional development, that is known as early childhood development. The other words which you will come many times while discussing nutrition is bedding in and rooming in. Bedding in means mother and child on the same bed. Rooming in means the mother and baby in the same room. There are different advantages of all this. We can go through the books or we can discuss separately. You have to follow the kangaroo mother care. Not only kangaroo mother care, we are now talking of kangaroo father care, or any relative in the family can give the kangaroo care. So it can be grandparents also. We'll see this CD, which indicates how the breastfeeding can be started within an hour. or on the delivery table
After the baby
itself.
has cried and started breathing well, baby is shown to the mother and kept close to her with a cheek-to-cheek contact. This helps the mother to kiss the baby and also facilitates the local custom of saying a holy message in baby's ear. Subsequently, baby is kept prone in between the breasts. All care should be taken to prevent the baby from falling. If the weather is cold, then baby should be covered with a warm cloth. Baby is very alert soon after delivery and hence is at its instinctive best. Baby is also kept warm, being in close contact with the mother. Baby is also prevented from future infections because she starts acquiring healthy germs which will colonize her skin and intestines. Thus, this position ensures early instinctive stimulation and gives warmth, love, security, and also food. It also initiates bonding process between the baby and the mother. Kicks will give tender, firm jerks to the womb, stimulating it to contract. This will help to expel placenta and reduce bleeding. Once baby realizes that food is in close proximity, it starts salivating. Smell is a strong stimulus which drives the baby towards the nipple. Baby's smell sensation is well developed. Smell of a chemical on nipples is similar to the smell of a chemical in amniotic fluid, which surrounds the baby in the womb. Mouthing movements start. Her shoulder, hip, and neck muscles are sufficiently developed to help her move. Baby with her limited vision can see the areola. If baby raises her head, it can also see mother's face. Baby has reached the nipple, has raised her head, and has nicely lashed it with wide open mouth and mouth full of breast. What a beautiful moment of joy.
So you have seen how the baby can be fed on the delivery table itself. This is not only for a normal delivery, but even in cesarean section, you can feed the baby on the OT table itself. Only care you have to take, you cannot put the baby on chest and abdomen, but you have to put on one side of the chest. Coming to the advantages of breastfeeding, again, there is a long list. We'll not discuss all those. We'll take some very specific advantages. It is natural, instinctive, and physiological. As we discussed, it is species specific and gestation specific. Free from contamination and adulteration. The milk is available at desired temperature, so no need for boiling. No exposure to foreign protein, which happens with animal milk. No need to calculate. Baby sucks as much as is his appetite. It is cost effectiveness. For mothers, there is a lactational amenorrhea which helps in child spacing. There is postpartum involution of uterus which decreases blood loss. The body figure is restored and it protects the mother from breast ovarian malignancy. The immunological advantage, the mother's milk is so important that it is labeled as a white blood or first vaccine for the baby. It contains IgG, IgM, and IgA, which is more in the colostrum. Thus, it prevents from GIT and respiratory infections. The various cells that are present in milk is macrophage, lymphocytes, and polymorphs. There are complement activator factors for C3 and C4. The lysozyme, lactoferrin, and lactoperoxidase are there, which lyse the microorganism and prevent from various infections. There are specific inhibitors against viruses and staphylococcus, growth factor for lactobacillus bifidus, and of course para-aminobenzoic acid, which protects against malaria. The biochemical advantages of cow's milk, as we have discussed, protein is 1.1 gram and against 3.3 in cow's milk. So cow's milk contains about 3 times more protein. The protein in mother's milk is lactalbumin, that is whey protein, while it is casein, almost 80% in cow's milk or animal milk, which causes curding of the milk in the stomach, and the amino acid pattern are better suited in the mother's milk. The lactose content is 7% as against the 4% in animal milk, and this 7% lactose makes the milk sweet, increases calcium and iron absorption and retention. The fat content is about 3.5%, same as in animal milk, but the essential fatty acids like linoleic acid is more, galactolipid is more, and this fat is better suited for better CNS growth. Other biochemical advantage includes minerals are about 0.2%, though they are less, but they are in a proper form. So it prevents solute overload, which can occur with the animal milk. Calcium phosphorus ratio is 2:1 or more than 2:1. This increases the better absorption of the calcium as compared to the less than 2.1 ratio in animal milk, which predisposes to tetany. The hematinics like iron, folic acid, vitamin C are either more or in a better form, so better absorbed. Vitamin K is less. This is supposed to be one of the disadvantage. Again, it is not that important disadvantage because we can give vitamin K, and that's why you must be knowing that we give vitamin K routinely to all the babies delivered. And the diseases related to vitamin K, that is hemorrhagic disease of newborn, but as we discussed, it can be prevented. And breast milk jaundice also, though it's more common with the breastfeeding, but please remember it does not need any special treatment. As against this, the animal milk will predispose to milk allergy. Cow's milk allergy we know is well defined entity now. Iron deficiency anemias, acidosis, and tetany are more common with the animal milk. The other advantages of breastfeeding are very important. One of the most important advantage is it prevents the diseases like diabetes, other chronic problem, asthma, allergic disorders, ear infection, chronic celiac disease. And the most important advantage is it stimulates emotional bonding between the mother and the child. It contributes to IQ. The IQ is about 3 to 7% more in breastfed babies. Visual acuity is better. Mathematical abilities are better, and so are the analytical capacity. And overall, it is eco-friendly. So that is very important to maintain the environment. Now, when we discuss about breastfeeding, which is very important, does it need any preparation or establishment? So there is no special need for preparation, but some minor things we have to do during the antenatal period. You have to motivate, especially to those mothers who are undecided. Confidence is to be built because many times the mothers may not be confident and even the doctors may not be confident that mother can give the breastfeeding. So what we have to do, we have to increase the confidence of mother, motivate her that she has to breastfeed after the delivery. We can tell her about information and education regarding the breastfeeding practices. If there are retracted nipple, there is no need to correct it immediately in the antenatal period. Many times it gets corrected after the birth of the child. Vigorous cleaning has to be avoided. A routine normal bath as a routine is sufficient, and if there are cracked nipples or if you give excessive cleaning, it can result into the cracked nipple. So what you have to do, you have to convince her that you are there if there are some problems after the birth of the child. So this is very important. You have to keep this in mind, that motivation and confidence building is very important. We come to various reflexes associated with the milk secretion. The most important is prolactin or milk secretion reflex. This is responsible for the amount of milk secreted. The enhancing factors are emptying of the breast, suckling at the breast, expression of the milk, and night feeding is equally important. While there can be hindering factors like if mother has some stress or strain, if there are some family problems, incomplete feeding, improper position, all this can result into the hindrance of the prolactin reflex. Similarly, the oxytocin reflex, which is also known as let down reflex, is there, and this is for the ejection of the milk from the breast. A positive thinking mother thinks lovingly of the baby. If the mother is confident, sound of the baby and sight of the baby is important. There are hindering factors also, which again include the stress and strain, the position, and other things. So why we are saying repeatedly about the position? Because it is the position and attachment or latching which will increase the breast milk secretion. Improper attachment or improper position may result in decreasing breast milk secretion. If you look at the first figure, you can see in the first diagram, there are two positions or two latches given. In one, baby mouth contain both nipple as well as areola. So it is important that areola is in the mouth of the baby because the milk is there in the behind the areola. And if the child does only nipple sucking, he may not be able to get sufficient milk, rather it will result into cracked nipple. So positioning with most of the areola in child's mouth is very important. Similarly, the position of the mother and baby, it can be cross cradle, cradle, football position, lying down position, etc. There is lot of misconception that if mother feeds in lying down position, she will roll over the baby and the baby will have asphyxia. But this is not common, or this is rather very rare, because mother is not anytime in such a deep sleep that she will roll over the baby without knowing that the baby is there by her side. Still, if somebody has very much doubt that mother may roll over the baby, what you can do, you can give the supervised feeding in lying down position. So there is someone who takes care or who supervises the feeding. So what is basic requirement for a proper position? The mother should be comfortable, relaxed. There should be backrest if she is sitting. Mother can feed the baby in standing position also, doing her works, and as we discussed, in sleeping position also. Baby's position during feed has to be maintained. Baby should have baby's body should be in straight line, facing the head facing towards the mother so that there is no problem with the latching. And after feed, it is very important for burping, which will prevent the vomiting subsequently. And right lateral position, baby should be kept for 10 to 15 minutes. This will also prevent the regurgitation of the feed. Factors which affect milk secretion, we already discussed. For any reason, if somebody feels that mother is having less secretion, these are the various factors. The factors which will increase secretion is suckling. As we know, it is a laid down reflex. Complete emptying at each feed is important because that gives message to the brain that breast is empty, and if secretion is not increased, less, next time the baby may remain hungry. There are some drugs which can increase the secretions, that is domperidone, metoclopropamide, and chlorpromazine, and other galactogogues. There are some Ayurvedic galactogogues also. We should know what is relactation and induced lactation. In relactation, for any reason, if mother decreases breastfeeding, the milk will go on decreasing. As we said, the complete emptying and suckling is the most important reflex to increase the secretion. But if mother feeds less, or if she feeds something else and the breast remains full, then the secretion will go on decreasing. So in some cases where mother was following these principles, or she was following this procedure, if she comes to you, what you can do, you can lactation can be stepped. So you stop all other things which mother was giving, like if it was stop feeding, if it was bottle feeding, you can stop this. Convince the mother that she has adequate milk, or she will produce adequate milk if proper precautions are taken. Induced lactation is usually in a person or in a mother who has not delivered the baby. So grandmothers or a mother who has adopted the baby can have the procedure for induced lactation, which includes suckling at the breast, though there is no milk secretion, giving the drugs like domperidone and metoclopropamide, which will increase the secretion through prolactin increase amount. The factors which decrease the secretion is reluctance in feeding. As we discussed, it is very important for the mother to have the confidence. If you give prelactal feeds, if there are pacifiers, anxiety, discomfort or emotional stress, decreased food and fluid intake by the mother, maternal malnutrition, and of course the position which we discussed. So you have to keep all these things in mind, which will increase the factors, which will increase the secretion or decrease the secretion. So there is some again technical problem and it may stop. So I would request all of you to log in again after 1 or 2 minutes.